that there are substantial inequalities, as you may well expect, between countries, also within countries, and that in some cases these are growing. The second important thing to say is that we know that there is plenty that can be done to tackle these inequalities, but they require big social, political, cultural changes, and they require action in what we call the social determinants of health, in economic policy, in policies for social protection, in education, in early years, in the built environment. A concerted effort is required across all these sectors, and then we will begin to see reductions in inequalities and significant improvements in health. Looking at some of the activities and some of the programmes who are part of the EPOD programme, we very much argue that community-based programmes are often the most successful, that having this kind of network is hugely important to learn best practice, to share information, to galvanise support, and also, very importantly, nothing will happen without this issue being prioritised politically. And it's very easy for issues to slip off the agenda. So having a European-wide and indeed a global network of this kind is hugely important to maintain political focus and act as an advocacy to ensure that obesity and inequalities in obesity don't fall off the agenda. One of the difficulties we have is that there are very successful small-scale projects across Europe and across the world, but it's very difficult to get these scaled up. We need information, we need to know that these programs are successful, and increasingly we need to know that they're cost effective. When we have this information, and I understand FE is collecting some of this information, we're able to achieve a scale which really begins to have significant inroads into the inequalities that we see across the world.